Welcome back. Well, an injury to the Achilles tendon can sometimes be pretty scary, but repairing the tendon doesn't always require major surgery.
That's right, and Dr. Iram Carrasquillo is part of the surgical team at Jacksonville Orthopaedic Institute. Welcome back to the show.
Thank you.
Appreciate you being here, and we're talking today about minimally invasive treatments for Achilles tendon injuries.
Yes, Achilles tendon is, as you know, it can be a devastating injury. The Achilles tendon, it's the largest tendon in the body. It can withstand approximately 10 times your body weight when doing sports activity, etc.
So what are some of the injuries that would cause something like this to happen?
Sure.
We were talking about somebody who was injured in the NFL with...
Richard Sherman, yeah, he tore his Achilles in the Thursday night game just past week.
Yeah, but for more people who don't play in the NFL, how are they doing this?
70% of the injuries are sports-related, where 30% are non. And certainly football is one of the biggies, along with basketball and tennis.
So the different types of injuries, because sometimes you'll hear, oh, it's an Achilles, tear, total pull, separation, and it sometimes completely separates. What are the different grades of injury there? Yeah,
there's the strains and there are the complete tears. Well, the tears are the more devastating type injury. The strain could be something that is not as terrible, usually related to tightness of the calf musculature.
So how do you know? I mean, you know because you're in probably immense amounts of pain, but how do you know that you've specifically injured the Achilles?
Surprisingly, it's not that very painful unless it's a proximal tendon tear. Usually when it happens through the substance of the tendon, it's rather painless. Most people are able to move the foot. It's you lose push-up strength, but certainly you can still move your foot. So surprisingly, many people go undiagnosed.
And then so they don't treat it. Now, is this something that if you don't get proper attention, it could get worse and exacerbated if you're not taking it easy?
Yes.
Yeah, okay.
Yeah, and that's...
I know some people that are like that.
No,
who
yeah.
are just weekend warriors and they just push it to the max.
Yeah, if you're just feeling some soreness, because you would feel some soreness and then you go out and play and totally tear it. Now, what are the different treatments though? If it's just pulled, do you guys let it heal on its own? But if it's torn, you have to go in, right?
Not really. You can treat it non-surgically. Usually it's for the people who are more sedentary and may have some other comorbidities, where the more athletic, younger, and healthy individuals will tend to have it surgically addressed.
Is that why? Because it seems like every time we talk about different knee injuries, ankle injuries, obviously in the NFL, it's, hey, this guy wants to play a few more seasons. Yes. It seems like the number one question you guys always ask is, what do you want to do with this knee, ankle, Achilles the rest of your life? And that determines what you're going to do? Certainly.
It's a very important part of the choice making process of whether you do it surgically or non-surgically. And certainly, like for the athletic individual, the younger population, the people who needs more push of strength, you tend to go surgically with them.
And with new techniques and technology evolving the way it is and doing things that are minimally invasive, right? I'm sure that this helps the patient not only recover faster, but I'm sure have better results.
Yeah, first, pain, as you know, is a big issue these days, and we try to use the least narcotics as possible. The newer non-invasive or minimal invasive techniques allow a small incision, probably just over an inch, and be able to repair the tendon, having less soft tissue damage and much less pain. And usually you can start recovery a little bit earlier.
And that's the key, right? Because you get this procedure done and you don't want to be sitting out for months and months and months, and it's tough, right? You can get back into physical therapy relatively soon after a procedure like this?
Yes, even though the recovery of such injury may take up to a year to fully recover, having a head start with the minimal invasive allows you to get to a functional level a lot quicker.
So important to get this addressed.
I'm in awe of what you're seeing on your screen there. This is a computer simulation of how you guys repair a completely torn Achilles, right?
Yes.
That is fascinating. Was that a robot? Was that robotic coming in there? Or
no, not really. We call it the jig. It's a instrument that allows us to put the sutures through the tendon without having to open up a big incision.
And where is this procedure performed with JOI? Because there's so many different branches.
Yes, all the JOI branches will have that available for you.
Yeah, I guess it's becoming more and more common, as people are, hurting themselves and getting out there, there's more opportunities and more locations to try to help provide relief to patients.
Absolutely.
Good deal. So good to see you. Thank you for being here.
Thank you.
We appreciate the time.
Thanks for being here. Special thanks to Jacksonville Orthopaedic Institute for making this segment possible. For more information, you can log on to their website, which is joi.net. You can also call their mainline number at 904-JOI-2000.